Hello, this is Ann Peterson, and today we're talking about bloodborne pathogens for EST summer course. Okay, so bloodborne pathogens is mainly what we're going to talk about, which is the definition would be pathogenic microorganisms present in human blood. And so this is something that you're not going to be able to see with the human eye. And people can have these diseases without us knowing it unless they inform us of it. Now, there is no reason that the person has to inform us of this unless they want to. So we won't know who has these possible pathogens and who doesn't. So when we look at some examples, HIV, hepatitis B, hepatitis C, malaria, syphilis, there's just a ton of different things that fall under this, and there's a complete list in OSHA. So when we look at potentially infectious bodily fluids, a lot of times you'll see OPIM, which is other potentially infectious materials. And the bodily fluids would fall directly up underneath that. Now, obviously, these are going to be present in the blood, but blood can be in a lot of different other bodily fluids, and those are listed here. So when we start looking at any bodily fluid, of how you could come in contact that within an occupational exposure, some examples here. Saliva when you're in the dental procedures, or maybe somebody, you're working on something and they end up having some type of cut or something like that. Skin, obviously, tissue, cell cultures, maybe working in a laboratory setting, and then any type of contact with saliva, vomit, urine, feces, anything that could potentially be laced with blood. So how does it occur? When we start looking at it, obviously there's going to be a person who's infected in some shape or form, and it's going to have to be actually transmitted one way or the other to another person, and that's pretty much what we're going to be talking about, and we're trying to break the mold here at the mode of transmission. Okay, so the big three that we're going to be talking about mainly is going to be HIV, AIDS, and then hepatitis B and hepatitis C. Now, with regard to HIV/AIDS, this was a big push back in 1980. I know probably none of you, or very few of you, were born at that point in time, but Nancy Reagan did a big push on whether people needed to know about this, and so she really brought this into the light. She did a really good job on that. So currently, when we look at the current statistics, and these are like 2006 statistics because they don't come out that often, there's about 1 million people in the U.S. who have HIV/AIDS, and so these are people who are kind of walking around. Some people might not even know it. There's about 24 to 27% of those people that aren't even listed in that. They're undiagnosed or unaware that they even are infected with any type of HIV. So when we start looking at the virus that leads to AIDS, obviously we're talking about HIV, and it does deplete the immune system. The good thing is that it doesn't live outside the body well, and so it's not going to be something that you can touch like a door handle or something like that and get HIV. Now, the thing with this is this does not have a vaccination that's available for it, and so you would have to make sure that you're keeping yourself safe in other fashions. Now, with regard to the transmission of HIV, and this is where a lot of people get misnomers about any of these diseases actually, but mainly with HIV, they seem to get really upset and scared. But when you start looking into it, something has to get into the body stream of another person, of an infected person to a body of an uninfected person. And this can be like what we're worried about with OSHA is the workplace exposure. And so it's coming in contact with blood or other types of bodily fluid. Obviously, or I hopefully would think that sexual contact sharing needles were not going on at the workplace, but sometimes someone might have a pregnancy and have some complications with that, or be in childbirth while at the workplace, and so you would have to take that into consideration. Breastfeeding, most people think, oh, that's not going to be bothered with me, but it is, and it's something that you do need to look at, because with Obamacare, they were making sure that the employers were offering a place free from the outside where a mother can go breastfeed or pump her breast milk for her baby if she's at work. And so this is something that will be seen on the horizons if you haven't already. If you have women who are pregnant, you do have to offer that. Now, once again, this is a misnomer, and a lot of people think that HIV can be spread through contact or saliva, and that says sweet. It's actually supposed to be sweat, spit, tears, insects. That at one point they were wondering whether mosquitoes actually would cause someone to get HIV. Okay, the symptoms of HIV when you start looking at this, and with all of them that we're going to be talking about, is you may have some flu type symptoms. And this could be like 1 month after exposure. And most people would not put that together if they had some fever or, just chills or something like that a month after they were infected. So it's something that kind of goes undetected quite often. Also, too, with HIV, it does have a long incubation period, and this can be anywhere from 7 to 10 years later after the exposure. And you can have some of those flu-like symptoms, and so people go into the doctor, especially if they start, having some major fatigue or, thrush, which is kind of in the mouth. But they'll go in and look at that because it doesn't last for just a few days like the regular flu-like symptoms or the flu does. And so that's when they start becoming concerned and they find out that they actually have HIV. Now, when you look at the AIDS, and it is a acquired immunodeficiency syndrome, is what that stands for, and it is an opportunistic infection, and it develops after contact with the virus, and it weakens the immune system, and then it is placed in the category as a syndrome. Now, AIDS, as yet, doesn't normally affect healthy people or people with healthy immune systems. It does the immune compromise, and that's so when you're getting into the HIV people. Um, the signs and symptoms are going to be swollen lymph glands, a fever, headaches. Once again, you're starting to get right back into the flu-like symptoms, and so a lot of times people do not realize that they actually have the AIDS. Without treatment, a patient could die from just a simple cold or maybe a bug bite that becomes infected or something like that. Now, HIV doesn't currently have any type of cures for this infection, and it does. We do have some medical treatment that are out there that actually treats the symptoms or treats the progression of, the delays the progression of AIDS. And so it does improve the quality of life of the person that actually has HIV, but it's not something that is going to be cured in any way, shape, or form. Hopefully, one time they will find a cure for this. I know they've been working on it for quite some time. So the next thing that we're going to be talking about, a bloodborne pathogen of hepatitis B, and it's commonly referred to as Hep B. Now this actually is going to infect the liver just like hepatitis C, but with this one, it can actually survive outside the body for 7 days. And so let's say that your employee is actually working on the floor. They are, they're doing something. They end up cutting themselves. Most employees will not just stop and go to the supervisor's office to get medical treatment. They're going to go to the bathroom. It's just kind of typically known that that's what people normally do. So they'll go to the bathroom. So now they're at the machine. There's blood at the machine. They've walked to the bathroom, however far that is. They've tried to wash everything off in the bathroom. And then by this point, if they can't get the bleeding to stop, they are going to go to the supervisor's office. And then now you have a path from the bathroom to the supervisor's office. Now, with this, it can survive outside the body for 7 days. So if somebody is not cleaning up this whole area, it does cause some concern for other employees that work there. And it can be spread quite easily. And so it's something that you definitely need to have a really good housekeeping program when you do this. Now this is just a look at a mapping which shows from the different areas, and I think this is it's either CDC or World Health Organization, and you can see some low prevalence, some very high prevalence, which is very interesting, and then some intermediate or some medium prevalence, but it kind of shows you where globally the major portions of the disease of this is. So hepatitis B, when you start looking at it in transmission, this can obviously since we're talking about it, through blood or any type of bodily fluids. And so we start looking at it. Can be found in body tissues, saliva, semen, any type of vaginal secretions, urine, feces, and then breast milk. The symptoms of Hep B are pretty much flu-like symptoms we've been talking about. Your loss of appetite, maybe abdominal pain, and we'll talk about jaundice a little bit later. But these are all things that people just don't think much about. They just think that they have the flu or something until they go in. They've had it for a while. They go in and get treated for it. We start looking at workplace Hep B transmission. It's going to be from two different areas, probably, maybe, well, actually three. This is going to be, a puncture wound, which would normally be like a sharps wound. This could be from a needle or something like a knife or something very sharp, and typically it's associated with a needle. And then a laceration, which is going to be a cut or an open wound. And you can see the difference here. This is very slender, and then this one is kind of gashed open and everything. And you can go ahead and get, you do have breaks in your skin and your hands all the time, and so that could be through that. And then also too, it could splash into your eyes, it could splash into your mouth if you're assisting someone in a work-related injury. This Hep B vaccination, they do have this. It is proven to be pretty effective, and it is in a 3-dose series. You do have to get them sequentially, one right after the other, and there isn't a time period through that. Employers are required to offer this to certain employees, which we'll talk about later, and they do have to pay for these. But as I said, we'll talk about this later. Now, hepatitis C was actually identified in 1989. And it is one of the most common causes of liver disease, cirrhosis, and cancer when you start looking at it. And so there are quite a few people that are infected with this, and they can be infected chronically globally as well. Here's a chart of that, and you can see in the Americas, and these are both of them put together, is 13.1 million. The Western Pacific's real high at 62.2 million, Africa 31.9. So it is a global infection. Now, most commonly, when you start looking at this, the most common reasons, I should say, is that a person has actually shared a needle, has had a blood transfusion before 1992. Maybe a person went in and got a tattoo, and the person wasn't clean, or they used different needles than what they should have. And so body piercing, all of those. Make sure that when you do go in, if you have tattoos or body piercings that are being done, that they're using a brand new needle, and you can see them actually rip it out of the package, because it does make a big difference. Now, when we start looking at hepatitis C, this can remain, like AIDS, remain in your system for years without a person even knowing that they have it. Now, it can be identified 5 to 8 weeks after the exposure of a person, and so if you're sending your employees to be tested, they may have to go back and be tested at a later date. Now, the testing, and we'll talk about this a little bit later, is if a person is actually exposed and they were not wearing the proper PPE, or they were and we'll talk about exposure here in just a little bit, but that would be something that you might have a retest done on that person. When you start looking at sources of infection, obviously a lot of these are going to be coming from injection of drugs. Excuse me. Or it can be sexual transfusions. Occupational is only set at about 4%, but that's a chance that an employer is not willing to take, and neither should employees. So the symptoms on this, when we start looking at this, is we're going to kind of talk a little bit about jaundice. Obviously, some of your normal flu-like symptoms that we've talked about. But jaundice, a lot of people think of jaundice when people first have babies, they have jaundice. But this is what a normal person's skin color, you can see the pinkish hue to it, and jaundice will definitely give off like a yellowish hue. And you can even see this in the person's eyes, you can see it in their fingers, and it is just something that's just very, very apparent. The person who has jaundice might not notice it, but you definitely will notice it, especially if you haven't seen them in a while. Something that they could be looking for with regard to jaundice too is a very dark urine. So let's talk about the bloodborne pathogen standard now that we've talked about what bloodborne pathogens are. Okay, so the Bloodborne Pathogen Standards in 1910-1030. Obviously, you don't need to remember that. Just know that there is a bloodborne pathogen standard, and this is really related to occupational exposure. Now, when OSHA started looking back at this, and this was quite a few years ago, they looked at it and said that, hey, there's a lot of people who have Hep B, and how much could it infect, employees. And they mainly looked at healthcare workers and any type of related industries that have exposures, and that's how they formulated a lot of these. So some of these are actually for the hospitals, but it is good for you to use for regular employees too. Also, too, when you start looking at it, the bloodborne pathogen standard applies to exposure to blood or other potentially infectious materials, and so you do need to make sure that you're including bodily fluids in that as well, and that the employees will have some way that they can report that immediately to someone. In this, you'll have an exposure control plan, and this is going to have the whole bit of documents that's going to be wrapped up in this. And so it can be called a bloodborne pathogen standard, or it can be called an exposure control plan. And it just depends on how your company wants to name it. This is going to be a written plan, which you need to make sure that you talk to your employees about, you've trained for them, and that it's accessible at all times in case they need to refer to it. The components, and we'll go through most of these, of the exposure control plan is going to know, what exactly are you going to do to have some type of exposure control. The employee determinations of exposure, how do you know if a person's exposed or not exposed? Methods of compliance, your Hep B vaccination information is going to be in here, as well as what to do after a person is exposed. When you start looking at communication, how are you going to communicate what is going to be considered exposure or what is not? Your training, and then also too is going to have to maintain record keeping. Your employee determination for exposure, this is going to say, okay, how many employees do we have here that could potentially be exposed? And so you're going to have like all of those positions. And then how many people in this company are probably going to be exposed or definitely could be exposed. And so you're going to have a list of those. And they are going to be defined out very specific to one of those or the other. And they're going to have like a list of tasks of that person and the procedures. It's not going to be actually an employee's name, it's going to be an employee position. And so one good thing about that, because people change positions so often, they may move from one position to another within a company, you're just actually talking about the position and not the person themselves. Now, when you start looking at a definition for an exposure incident, OSHA actually defines that as an eye, mouth, or other mucous membrane, non-intact skin, or parental contact with blood or other potentially infectious materials that result from the performance of an employee's duty. And so when you look at this, it has to have some contact, whether it's going to be absorption, it may be injection, it could possibly be, maybe the person, it gets it in their mouth, and so it could be ingestion. And so it could just be any of those, but the main key here is that it's the performance of the employee's duties. And so that is when we're looking at it being an occupational exposure incident. So who's covered by the standard? And this is where you get into who do you train, who do you don't train. Any employee who could be reasonably anticipated to come in contact. And so would a person or would not a person come in contact with it? And this is something that you're going to have to determine, because with regard to this, if an employee is working next to another employee and that person's hurt, typically they work alongside each other all days. And so if a person is injured, that other employee is going to help them. Now, this cannot be in the person's normal duties, and it may not have anything to do with their job in a sense, as a coworker. But a person's going to have humanity and probably help someone. At least try to stop the bleeding before something happens a little bit more. And so this is where you start getting into who should you train. Should you just train everybody? Should you just train the people that have been listed in your standard? And this is where we just go ahead and in the companies that I worked for, and we trained everyone. It was kind of just covering ourselves so that if it came back to it, everybody was aware of it, everybody understood. And also, too, it's kind of nice for all employees to understand this, not only in the employer-employee setting or in a work setting, but then also at home, too. So when you start looking at Good Samaritan acts, and this is where it gets into, was the person, doing this out of the goodwill type thing? If a person has a nosebleed, that's probably not going to be covered. Or I'm trying to think of another example. I can't think of it right now. But those would not be occupational exposures. So if a person, let's say, I thought of another one. If a person was having a baby, and if she just had the baby and you were helping out, that would probably not be an occupational exposure. But it tries to get into some of these. Would your company consider this as a Good Samaritan act and not cover you, or would they cover you because you are helping another employee? And that's something that the company and management just needs to determine. So in occupational exposure employees, and this is where you get at all at-risk employees, you do have to make sure, and these are the people that we've listed on our program, their job titles in our program, will receive specialized training, and so you have to do this on an annual basis. And once again, I said our companies, we just went ahead and did it for everyone on an annual basis, and then we did a little bit more specialized training for some of our maintenance workers and supervisors, and so they had a little bit more first aid and understanding of exposures and things like that. But that's not necessarily that you have to do that for everybody. Now, you also have to make sure that they're offered the Hep B series, and they have where they can actually decline it if they don't want to, and we'll talk about that here in just a second. They do have to have some type of understanding that they'll have a post-exposure evaluation and what that's going to consist of and what the follow-up would be. And then also, too, any type of PPE, you have to have that readily available at all times. And this is an example of a declination form, and you can just kind of read through it here. Essentially what this is saying is that the person has decided that they do not want to receive the hepatitis B vaccination, and they can come back at a later date and say, yes, I do want to have it, and this just is just OSHA verbiage with regard to that. So let's talk a little bit about methods of compliance. When you start looking at methods of compliance, mainly you're looking at employee protection, and this can be through universal precautions, training of employees, any type of engineering controls, work practice controls, PPE, administrative controls, vaccinations, any of those. Okay, so let's talk about universal precautions. When you start looking at this, and OSHA defines this as a practice whereas blood or bodily fluids other than your own are treated as though they are infectious. And essentially when I used to explain this to employees when I would do in training about universal precautions is that I would treat everyone as if they potentially were infectious. Now this would include the president of the company or the worker on the floor or the people that I'm just meeting right now. All of those people I would treat the exact same way. Now if I were at home and something happened to my husband or something happened to one of my children, I probably wouldn't use universal precautions because I have a little bit of knowledge with regard to their past medical history. But at work, it's different, and everyone will be treated the same. And so, not to offend anyone, I do make sure that I talk about universal precautions and why I'm putting on gloves if they are injured. So let's talk a little bit about engineering and work practice or administrative controls. Now your engineering methods, as we talked before with regard to other things, is that there is this is where you're actually removing the employee exposure, and so the employees don't come in contact with it at all. And some examples of those engineering controls are sharp disposal containers. If you've ever been into the casinos lately, you notice that they have tons and tons of sharps disposal containers all over the place. They also have self-sheathing needles where the needle isn't like protruding from it; it's just kind of covered. And then they are getting into some needleless systems, excuse me. And so then the person never comes in contact with any type of sharps. When you start looking at hand washing techniques, I know this is something that everybody thinks they know how to do, and it's kind of one of those redundant things that you need to talk to employees about, but it is something you want to speak with them about. So, when washing your hands, obviously, you want to tell employees that they need to make sure that, obviously, when it's dirty, after using any type of bathroom or washroom, after removing gloves or blowing your nose, sneezing, that type of thing. And a lot of times, what I'll do is I normally put this training, excuse me, in with my training about flus, and so we would talk a little bit about hand washing and how to do that. Obviously, before and after eating, handling food, any type of smoking, handling garbage, any of those instances, the person does need to make sure they wash their hands. And so the technique for washing hands, once again, I know everybody thinks they know how to do this, but we actually went through exercises on how to do this when we talked about the flu season as well as the bloodborne pathogen. But removing any type of rings or watches before, and that says watching, but it actually should be washing. And then making sure that the paper towels are available there, so you're not having to push a button or something like that. And then here are some procedures with regard to that. Work practice controls, which are also administrative controls, are kind of used synonymously depending on which area you're looking at in OSHA. Work practice controls actually are just looking at reducing or minimizing the employee's exposures to blood or bodily fluids. And this can be just a lot of different things. There are some examples here. One thing that we did have was employees would walk in and they'd have these open wounds and they were letting them air out, which was kind of disgusting. But we made a policy that everybody did have to have these covered at least at work with some type of bandage or band-aid, one or the other. And then also too, we had procedures in our exposure control plan, or rules if you want to call them that, and it was stating that you could not eat on the factory floor. You could only have covered drinks on the floor. No smoking, obviously, in the facility or anything like that. And then we would talk to them about our wastes and how they were supposed to baggage wastes up and everything. So then it kind of goes into housekeeping. And this is also falls under administrative controls. And sometimes, if you're in like a hospital setting or something like that, obviously you need some type of schedule for cleaning or decontamination. But a lot of this stuff is going to be done on the fly because you not necessarily know that a person's going to be injured. And so it's going to cause some issues when you start looking at, what is the schedule that we're going to be doing this with. Now, you do normally have, most companies have some type of housekeeping where they'll go in and clean the bathrooms on a regular basis, and I would definitely document those and make sure that you're keeping that because it could fall under your bloodborne pathogen or your exposure control plan. So general work guidelines when you're talking, and these are just some rules, and I would place some of these next to the areas. Making sure that the person's not reaching into any sharps disposal containers. Once again, you think this is going to be real common sense, but there's been several times where I've actually walked by a sharps container or a biohazard container, and one time I found a spoon and a drink glass on top of it and somebody's gloves, and so people don't think of them as biohazards. So the next thing we're going to talk about is decontamination procedures. And this gets into actually the cleaning up. How are you going to disinfect after something some type of surface, has come in contact with blood or other potentially infectious materials. And so just having those things available for the employees, making sure that they are disposable, so that you can utilize those. Procedures, these are some procedures with regard to it, and your company will have to just look to see exactly what that is. Making sure that you are training your employees, which would also fall up underneath the administrative controls of how to actually bag up that infected materials, and making sure that they're not going to be contaminated in doing that. And then how do you decontaminate a mop or a broom and that type of thing. All of those procedures need to be listed in there. So medical waste. And most times people think medical waste doesn't apply to them, but it does. I mean, you're going to have accidents on the employees or from the employees on the floor. And so what are you going to do? You're going to make sure that you're going to clean that, whatever it is up. Or if maybe the person used a bunch of paper towels, a lot of people just kind of throw that into the trash can. So you have to make sure that you get all of that and put that into some type of red bag or biohazard bag. And so any type of soiled sharps or saturated materials, anything that has blood on it, needs to be placed into a red bag, or the sharps need to be placed in the sharps container. And just informing your employees of that is very important. So PPE, and this is what we talked about previously, or we're going to talk about. I'm not sure how it is on the schedule, but this is where we get into some PPE that the employee can actually wear. So this is obviously going to provide some protection, probably not the best protection, but is going to be, your last resort protection. And this is going to have to be really chosen with regard to the task that the employee is going to be performing. So if they're going to have where they want to where the employee is going to have to clean up a mess, and they may have to have something for their shoes. Or if a person is just going to have something with regard to their skin or their mouth or their eyes, it just kind of depends on what that employee's tasks are going to be. If they're actually helping with regard to first aid, then we need to make sure that their mouth, their eyes, their skin, all of that is covered when they're assisting with that. And so these are some examples of PPE that you might see that are listed in there. And it just totally depends on what that is. And I do see we had mouthpieces down there, resuscitation bags, and pocket masks. And that's not something that's so particular anymore. Just real recently, the American Medical Society, as well as the Red Cross, when they're training with regard to CPR, you do not have to use the face masks. But it is something that I would go ahead and train to, and I would have those available. They have said that now it's only compressions, but so many people are used to the mouth to mouth as well as the compressions that may be something that you talk to your employees about. Removing contaminated gloves. I know this is something that everybody thinks they know how to do, but in the regular class we actually go through this. Given the fact that this is an online course, it's obviously hard to do, but if you want to get a pair of gloves out there and try to do it on your own, you're more than welcome to. What you're needing to do is actually pinch one glove by the cuff, and this is going to be on the inside area, and then just kind of peel it off your hand. What you're trying to do is actually peel it inside out, and so that most of the contamination is going to be on the inside versus the outside. And then you're going to make sure that you hold it in your one of your hands, whichever hand obviously still has the glove on. Once you do remove that, you still have the glove on the other hand. You do need to hook your fingers inside the cuff of the other glove and just kind of try to roll it up. And when you roll it up, it's going to roll up over this glove as well as the glove that you have on your hand. And you just need to make sure that you're not getting any type of contamination, and that's trying to show people how to do that without having some issues with that. The final thing that you want to do when you do remove the gloves is make sure you wash your hands with a non-abrasive soap so that anything that may be contaminated might not be um, you know, washed away. And this would maybe be any open contact of skin. It used to be if I helped someone with an incident, I wouldn't just wash my hands, I'd wash all the way up to my elbows. So communication of hazards to employees and training. This is going to be done through a couple different ways. One of them is going to be labeling, and obviously if you have your biohazard containers marked properly with the information, which is going to be this biohazard symbol with the words down here, a person should know what that is, but doing the training and making sure that they do is going to be helpful for you as an employer. Training is like most programs. Obviously, when you first are hired, you need to be trained. If you changed positions, you need to be trained. And then anytime you return, when you have already been trained, you just need to do it on an annual basis. And so making sure that you're doing it in those three areas are going to help cover you with regard to your program. One of the things you do need to remember is keep your attendance sheets, and this is across the board for anything. And they kind of go back and forth on this, and I'd probably keep mine for more than 3 years, but it must be kept on file for 3 years according to OSHA. And making sure that you're keeping those so that you can have those easily accessible. Not necessarily do training sheets need to be online, on paper form, but they can be online. So if you do have a scanner and you can put those in there, but I'd have a backup of a backup just in case, OSHA needed those. You need to get to them to them in a very short period of time. Vaccinations, when we look at that, obviously we've talked a little bit about the Hep B vaccination. This is going to be free for the employee, and they do not have to take time to go get this. It normally costs an employer about anywhere from like $90 up to $150 depending on who you get those from. But it does need to be free to the employee. And when you do this, obviously they're going to have to sign a form saying, yes, I do want the vaccination, or if they sign a declination form, you don't have to offer that to them. But they can decide once again at a later date that they want to have those. Post-exposure and follow-up policy does need to be included in your exposure control plan. Now on this, you do need to make sure that the employees know that if they have been exposed, and this is an exposure without the proper PPE, that they wash the exposed area immediately, as mentioned previously, with a non-abrasive soap, and so they can't go use the pumice that's in the soap because it just causes more scratches in the skin. They need to make sure that they understand that they have to report the incident immediately and that they have some type of post-exposure evaluation. Now this can be where, excuse me, that the employer is seen immediately and maybe then, a few weeks after and a few weeks after. And I would probably have someone look at that and make sure that we are looking to see when those need to be evaluated. The free of charge, obviously, for any type of post-exposure medical treatment that they have. Essentially what they're going to do is document it, and then they're going to make sure that they have the information down from the employee. An employee can say, no, I don't want to have any type of medical attention, but you do need to make sure that you keep that in writing in the file of the employee and what their reason is. And then if you have any forms or anything like that, you need to make sure that those are obviously completed as well. This is an example of an exposure incident report log, and it's actually a pretty good one. This is from a school up in New York, I believe. But it has all the good information on it. Obviously, you're going to be doing this for every calendar year. The facility name, address, city, zip, that type of thing. This may be the safety manager or the production manager, however you want to do that, but somebody's name who's keeping track of this, and the phone number. The case number is just 1 through whatever, and you start renumbering every year. A lot of companies will put 2012-001 or something, and that's their coding. So you can put maybe 1 over here if you want to, and then do a coding however you want to do that. It's totally up to the company. So this isn't record number is not mandatory. But the date of exposure, the location of the incident, the route of the exposure, how did it get to the person, an affected person, the nature of the incident, and then the description of the incident or of the exposure, those are going to be necessary for you to do. These two you can actually make sure. This one I'm not quite sure of, because a lot of times you don't want to have somebody's name on there, um, but you may assign them like an ID number where it's listed someplace else. And then on this one, you want to make sure that you document, okay, did the person get medical evaluation? Who was the follow up with? And make sure that you put all that information down. So this may be, a pretty lengthy document, but hopefully you won't have very many of those. Okay, on record keeping, we have talked about the medical records, and this would be like if an employee actually left to go see a medical doctor. You do want to make sure that any records that are simulated by that are kept the duration of the employment plus 30 years. Definitely making sure that you document, who the employee saw, what the physician's name was, the time and the date, or a lot of information on that. You do need to keep track of that. Your training records, those are needed for 3 years, and as I mentioned earlier, I'd probably keep those longer because they keep going back and forth on that. And then your sharps injury log, which I'd probably keep a little bit longer too, but it's 5 years. So, well, hopefully this has given you a lot of good information with regard to bloodborne pathogens. Make sure that you do complete the quiz on Canvas, and send me any information if you have any, or if you have any questions. That would be great too. Thank you.